Margherita,
Hi,
how are you?
I'm good. How are you?
Where are you?
I'm in Italy now. I'm in Milan.
Milan. You work
Yes,
in Sarafel?
yes, with Dr.
Okay.
Montorsi
Hmm.
and
First thing,
Professor.
how did you come to know about this competition?
It was Dr. Gandaglia, Giorgio Gandaglia.
Hmm.
I've been following him since 2 years now,
Hmm.
and he actually proposed to me the this experience, and then I
Hmm.
applied.
Okay, okay. Tell me, so tell me everything about you, what you can. Um,
Uh,
uh, you are
as a
already a
first,
medical student? You are a
Mhm.
medical student?
Yes, I'm a med student. I just finished my 5th year of med school, and now I'll be starting my 6th year and last year of med school. Um, and yes, then after graduation, we have the national test to get into specialties,
Mm-hmm.
uh, and that's gonna be tough.
Mm-hmm.
I only have left 2 exams, and then I will be working on my thesis, actually at King's Hospital, and it's going to be like a 6 year of thesis of project at King's in the urology team, in prostate cancer urology team.
Kings in London?
King's in London, yeah.
You're
It's a
working with
sort of
Dr. Das
collaboration.
Gupta?
Yes,
With Dr. Das Gupta?
yes.
And what are you going to do? What are you going to do?
Um, so the project is not yet defined, but it's going to be on artificial intelligence um, or biochemical um, recurrence of prostate cancer. We'll be
Okay.
starting on September. We'll be starting the project.
And but then you'll go to London and stay there
I
for
will go
six
to
years?
London. Yes. Yeah. No, not
Six
for not the whole 6 year, but for like 6 months, I will be staying in
6 months.
London. Yes.
Okay. Sixth year is a mandatory thesis for you to pass the
Yes.
exam?
Yes.
Okay. And
It's
did you
kind of
did you rotate? Did you rotate in urology?
yes, I did. I'm actually
When fourth
full
year or
intern.
so?
I started my fourth year, yeah. So it's been the whole
Hmm.
4th year and 5th year. In Italy, we're like free to go wherever we want to.
Hmm.
It's a bit more free than America because last
Hmm.
year I went to Stanford in urology
Hmm.
uh, for a rotation project.
Hmm.
They were a bit more strict than at Raffaele hospital. But yeah, we were like free to go wherever we want to if we want to look at
And who did you
pediatrics.
work at Stanford? Who did you
Uh,
work with?
I was with Dr. Ben Chung,
Hmm.
and then I met basically every doctor working in the urology team. They were
And
amazing.
what did you do there? What did you do there?
It was just a rotation, so I was able to participate during surgery, clinical, basically everything.
Tell me, how did you make up your mind for urology? Why not
Oh,
cardiac surgery?
So I always wanted to be a surgeon. I didn't
Hmm.
know which type of surgeon. So I think that urology is great because you can do both surgery, clinical experience, and also a lot of research, which is something I really like. So it's the perfect match and mixture between everything, basically.
Did,
Uh,
did you shadow in other specialties also?
sorry.
Did you shadow in other specialties also before joining urology?
I've always liked oncology, but it was not
Hmm.
a surgeon job. So
Okay.
it was more clinical. So that's also the reason why I like urology, because there is a lot of uro-oncology that you can do.
Yeah. And your family, anybody doctor in your family?
So I'm the first doctor in family. So
So how
they're
did you become a
super
doctor?
excited. I think it's something that I always wanted to do since I was like 8. Then my grandfather got sick he had pancreatic cancer. It was something very, very quick. In like 3 months, he passed away.
Mm-hmm.
So I was always like, I wanted to help and to know much stuff about diseases, cancer. So it was something.
And your family is from Milan,
Yes, they all from Milan. Yes.
and your dad is a businessman or something?
He's an architect.
Architect. Oh, your mom also works?
Yes, she does. She's in real estate. So
Okay.
I'm completely external from everything in my
Mm.
family. I've got two sisters, they're lawyers, and my brother is an architect as well. So
And your two sisters, what are they doing?
they're lawyers.
Lawyers.
Yes.
Everybody settled in Milan.
Yes, they're all in Milan.
Mm. So what do you like about medicine the most now? You spent 5 years in medicine.
I
You don't
like
regret your decision to join
no,
medicine.
no,
Mm.
it's been tough. It's been really, really tough. Also
Uh,
because I really like to, get well in my exams. So I've always been passionate about studying. It's been really tough, but I really like it. I do not regret anything. I will do it the exact same pathway as I did. But I
yeah.
really like it. I know a lot of things. I like the fact that I can like cure my family. So yeah, I really like it.
What you like the most when you work from morning to evening in your present role?
I think get to know patients.
Patients.
Yes, the
And
relationship with patient is something that I really like, and it's something you can do in urology as well, I think, because you
how
can.
do you find a correlation or balance between patients' emotions, patients'
Uh,
personal life, patients' social life, patients' economic status, and what you think is right in medicine?
so I think that it's really important to have empathy because sometimes doctors lack of empathy because you get used to death, to diseases, and sometimes it's really difficult to actually know what the patient feels when they're like having a cancer disease. Uh, but yeah, I think we all have to have a balance between empathy and um, sort of distance between the patient as well. You don't have to get too much involved in with the patient history, but you also have to know the patients because you want to know especially I think this is especially in America where you don't have a national health system, while here you can get basically everything for free. In America, you have to have an insurance or you have to pay for it. So yeah, you have to know the patient's economical status because you have to offer him the best cure as possible with the needs that he or she has.
You said you are going to work with Procarn on some neural network artificial intelligence project
Yes.
on predictive modeling. How
Mhm.
much do you already know about artificial intelligence?
Not very much. I'm getting to know everything and during these days to
But
go to learn.
you have a general knowledge, not maybe as a
Yes. I know,
physician.
I know.
So how do you think, what are the future challenges to medicine when machines take over,
So I
when
think that
machines will decide?
Mhm. So I think that artificial intelligence could be a really great opportunity for us, but we have to be careful because it's always something not human. It's artificial intelligence. So we don't have to, I don't know, like let them do our work, like the artificial intelligence. But I think that could be a great help. Also, for example, in data analysis, or in surgery, for example, with the Da Vinci robot, it could help a lot. So we'll see. I think it's
Mm.
a great opportunity, but we have to be really careful.
Yeah, very right. So tell me, what are your hobbies other than medicine? Anything else?
I really like running because I'm in the athlete sport team of the Raffaele University. Um, and then it's really not that much free time that we have, because basically we spend the whole day in university, because you're in the morning. We usually have rotations from 7 a.m. to 1 p.m. and then we have lectures until 6 p.m. and then you usually have to study after lecture. So it's a long day and there's no that free time for hobbies.
Currently, are you doing any research with Giorgio?
Yes, with Dr. Gandaglia, we've been working on some projects. For example, we've been publishing some papers on prostate cancer patients that has been undergoing the prostatectomy. And we've been analyzing the recovery, the functional recovery with both incontinence and erectile dysfunction. We've been following up the patients. I've been calling patients, and we've been also comparing the patient that have been done the physical therapy, the pelvic floor exercises after 6 and 12 months. And we've been seeing that pelvic floor exercise is actually improving a lot the functional outcome of the patient undergoing the prostatectomy.
Tell me something that, are you excited about going to Ghent?
Yes, I really am. Also because urology is the field that uses the most the Da Vinci robot. So it's a great opportunity, because in Italy we don't have that much time to spend on practical skills. So I think this is a great opportunity. Yeah.
And what agenda you're going with? What do you all plan to do?
So I'm flying
No, what do you plan to do there?
There at the end. I think it's going to be like practical courses with using the Da Vinci robot, and I think also lectures. And then on the first day, we're going to have a boat tour, so we can get all to know each other. And then, yeah, it's going to be lectures and hands-on training, which is something super excited.
Yeah.
So, yeah.
Yeah. And tell me about that. How do you work from morning to evening with no hobby or anything? No holiday, no hobby?
Well, we have weekends off. But Stanford, it's a super competitive university, actually. We're all very competitive. So sometimes it's really difficult to have time off completely. That's the reason why I told you that it was quite really, really tough during these last 5 years. I think you just get used to it. You just get used with working a lot, go to lectures.
How do you de-stress yourself when you are so overwhelmed with homeworks and projects and all? How do you de-stress?
Running, just running a lot.
Running, physical exercise you do?
Yes. Yes,
And
during
that takes away your negativity and things like that, isn't it?
Yes.
Do you meditate or anything?
Meditate, no. I did some yoga, but not yet meditate.
Who did you learn yoga from?
It was a teacher. It was actually my ski instructor when I was a child. So she's now a yoga teacher.
So what exercises you do and what asanas you do in yoga?
I don't know the exact names. They're really difficult. It's like
You
1
do
hour. No, not
every day.
Once a week. Once a week.
Once a week. And you use your physical jogging as a de-stressor.
Yes,
You have any friends?
Yes, of course, with friends. We have the school sport team, so we all run together. And in November we have a national competition in Rome, so we'll go in November.
Oh,
Yeah, that's
okay.
exciting.
Tell me what's your dream?
My
Do you
dream?
have any dream?
I think that my biggest dream would be um, to be a very good doctor, a good surgeon. I think it's really tough nowadays to be a female surgeon in Italy, especially in urology. Every time I say to someone I want to be a urologist, they're like, "Why urology? Like you're a female, you should be done gynecology." I'm like,
Yeah.
"No." So it's something really tough for the other people which are outside the medical field to actually understand what is urology and what's behind urology. So I think that if people actually understand what's behind urology, that would be a great goal for me.
And how much do you know about the events and news and world news and what is happening around in Italy and outside? You
So
have any update on or no interest in that?
yeah, just a little bit. I have to be honest, I'm not super updated on everything. I
But
try to get to
but
get some
you have
news from Milan.
you do have opinions or no opinions? No discussion,
Like
no
political
opinion.
opinions.
Hmm.
Not very much.
Not very much. You don't get in arguments with your
No,
friends.
not really, not really.
Uh,
About politics, no.
and what's your understanding of religion?
I think it's I've been grown as um a Christian family, uh, but then I actually got a bit of a distance from religion. But I totally understand it. I totally like um think that it's a great opportunity, especially for people that do not have much. I think that religion is essential for some people.
Hmm. Not you don't find any place of religion in your life now or later.
No, not really, not really.
Hmm.
I think like I know that there is something, there is someone, but I don't really find like a face. I don't know how to
Yes.
actually
So
explain. It's a bit.
let's take the most significant event which took in your life so far, and let's imagine. I assume it would be your information that you have got onto medical school, isn't it?
Mhm. Yes.
Is that the most significant event, or is there anything else you can think of which was very exciting you were looking forward to?
I think getting into med school was the best thing I had in my life.
Yeah, yeah.
It was
So now tell
like
me, you worked hard, right?
yes, yes.
And you worked hard, and uh, everybody works hard. How many students in your class?
We're 80. It's a
80.
small
And
class.
how many were looking for these 80 spots?
I think all of them.
Tell me, why only you got selected or 79 others got selected? It's only the hard work. Everybody worked hard. It's only the intelligence. Everybody is intelligent.
No, I
Is there
also
somebody? Is there somebody else you need to credit?
no. Uh I think that is also passion and empathy what makes the difference. The and also what you want to make the difference in. Uh I don't know. I think that um is not always intelligence, is not always getting the maximum grade. Uh, you also have to be like intelligence on a hard point of view. I don't know if you know what I mean. Um,
Explain to me. I didn't understand.
um, it's like being, uh, I don't know, like feel connections with each other, with souls. which
Yes,
is something
yes, yes,
that also have to do with patience. So it's
yes.
not always like
Yeah,
what is
yeah.
written in books.
See,
It's you always have to
yeah,
face like 50 different shades of everything. It's not always
yeah.
black and white.
What you
And
said earlier, that we don't know who is, but there is some superpower which is working,
yes,
right? It
yes,
works better for you or me or somebody else. We don't know. We don't have to know. But all I
exactly.
want to tell you that you have to keep your ego balanced, that you got it everything because of you. It applies for me also and everybody.
Yeah.
There is something which has happened. And many times you look back and see, oh my God, how did I get it?
Yes. Yeah, that's right.
Mm.
Yeah, when I got the actual news about Ghent and everything, I was like, wow, this is incredible. I don't know how did it get
Yeah, you
to.
tell me, because we had closed it. It's simply because one student did not get a visa from Turkey. So we
Mhm.
had one more spot. And in the meantime, your application came, and we were thinking whether to have two people from Italy or not. But then we liked your
Thank
application. So this is not a coincidence, much more than a coincidence.
you. Yeah, it's true.
It is synchronizing your thought process, your actions with our thinking.
Wow. That's magical. What like
Yeah.
is something.
Okay. So I think, what's your plan for meeting international students? What
Hmm.
nodes you are going to exchange with them?
Well, I want to know like their project, and also I want to know what is med school there in their own countries, because it's always
Mm.
nice to know what they can actually do during their rotations, what they also for example, the lectures they have, because for example at Stanford, the med student from America did not have a full course of urology, nephrology, oncology, while in at Raffaele it's completely different. It's very well structured because we had like a whole course of 50 hours of lectures about urology, of nephrology. So I think that it's it's a great opportunity what we have in Raffaele.
Even about research and innovation, I don't see much of the American students are in it as Europeans are.
Yeah,
Or
that's right. We had
England,
some.
England, England, they are doing a lot of research at King's College, medical student,
Yes.
and University College of London and Imperial College London. But here they are totally bogged with medicine. I don't see. They do research in pre-med years, but not
Yeah,
as a medical students.
yeah, that's right.
Or they will do it after they graduate.
Yes, because you have yeah. But yes, in Italy, it's I think it's a really great structured plan. Even though sometimes does not always work. You have to be like you have to want to be the best. You have to yeah to want to have what you have, I think.
I think I'll come to my last question. What do you think about Foundation's project on what you call Vattikuti Explorers? What do you
I
think
think
we should be doing? What do you
uh,
think? It's number one, it is in place or is out of place? Does it gel with something which is non-existent? And what more we should do, understanding that students are over busy?
okay, so I think it's a great opportunity what you've been doing. I think that people should know more about it, and this is something like, for example, us could do, like tell our classmate about this project, so that they can actually know to get better everything. And I think it could be a great support for the med students, also for the research point of view, because you can do a lot of research. And the foundation can actually help us to guide us in the medical field, which is always huge. And sometimes med student can be a bit lost in the field.
See, let me tell you why we created that. Students in India and other places are not so fortunate as you at San Rafael, where you have Montorsi and Briganti and Gandalia, who knows the whole world of urology, and they could connect you to Prokar Dasgupta or send you to Stanford. Foundation wants to act as a catalyst, identify students with their interest and connect with our network, which is all over the world.
Yes. Yeah,
So if you are looking for a predictive model, I would connect. Of course, Prokar is good, but I'll connect you with one of the best modelers in the world. And somebody looking for a molecular, looking into gene. That is what our hope is. And mind you, Margherita, it's not going to be large number of people. My little experience shows that very few would be, out-of-box thinkers. Most of them are mundane. They want to get the postgraduate seat or work as a good doctor, and rightly, nothing wrong in that. But
well, if you want to really grow and have something at the end of the day, I know. I know about it.
yeah. So if you have any questions, otherwise, thank you very much. If you have any questions, you're most welcome to. Thank you for your time. And I enjoyed talking to you.
Thank you. Me too. It was a pleasure meeting you.
Yeah. All the best and come back with good memories from there. So
I will. I will. Okay. Thank you very much.
bye-bye.
Bye-bye.